discuss climate change and climate action in a patient safety meeting. No one knows more about risk and harm and how to prevent harm than the patient safety people, right? We know risk, we know harm. There are a lot of harms from climate change on both health as well as health care. And we have the skills, we have the knowledge, we understand systems, processes, culture, data, technology, and we bring a lot of skills to the table that can be used to prevent harm. Now this is a source from CDC. I don't know whether this is still available from CDC website, but it's a great visual on the impact of climate change on health. And you can see whether it's from extreme heat waves, rising sea levels, changes in the vector-borne disease patterns, airborne air pollution and other airborne pollutants. There's a lot of impact from climate change. I'm not going to go into detail because the Lancet Countdown spends a lot of effort. You should look at some of their papers. They have a report coming out every year on documenting the impacts of climate change on health. Now, why in healthcare we must talk about this and do something about it? Not just because we might stop functioning, right, if there's a climate catastrophe, but there's other reasons why. The global footprint, the carbon footprint from aviation is about 2%. The global footprint from healthcare is double of that. That means we in healthcare produce more emissions and have a higher footprint on the environment than aviation globally. So that's a pretty big number to think about. Where are these emissions coming from? It's not just the energy we use, but it's all about the stuff we do in healthcare. So if you look at the smaller circles, the blue and the orange, it's about sort of the energy type things, the combustions and the energy and all that. But look at the blue circle where most of the emissions are coming from. And you'll recognize that's what we do in healthcare delivery. We use medications, we do procedures, we travel, we have a lot of waste, food. Think about all of these things that we do in hospitals and healthcare systems, and you'll realize where these emissions are coming from. These are called Scope 3 emissions, in case you hear that word. Also, some people call them supply chain related emissions. And that's what the biggest contribution is. About 70 to 80%, depending on which study, emissions come from the supply chain and these products. So this is a paper by some of our colleagues that sort of first got me interested and tied the two fields together. They made a case that all this pollution stuff, at least in the United States, is the same magnitude as medical errors. And this caught me like, oh wow, this is just like any other patient safety problem I tackle, and really is a good number to think about, that it has pollution and all this has very similar magnitude as medical errors. Now, why aren't we doing this already? Why are most of us in the red and the yellow zone? Patient safety improvement, and literally they are the same, right? Leadership, competing priorities. We're always putting out some other fire or the other in what we're doing in healthcare. There's always some catastrophe happening, and these things that are more long-term often sort of get forgotten. And there's of course a lot of these socio-political, socio-technical types of issues that also delay action in this space. Now, we produced a paper with the National Academy of Medicine in the US about why should healthcare leaders care about this topic. And there's two on this. There's 7 reasons we gave as to what is a business case, if you will, to do work in climate action if you were a healthcare leader or a CMO or a C-suite in a hospital or a healthcare system. There's 2 I want to highlight which closely relate to what we're about. One is high-value care, and you'll see why I'm trying to make that connection. High-value care is climate-conscious care. The second one is workforce, employee recruitment and retention. 75% of clinicians on a survey last year said they want their healthcare system to do something about climate action. They need some action from their healthcare system about climate. So that's really important. And I think over time, the workforce is going to shift towards healthcare systems that are doing a better job with sustainability and climate action. Now, we understand quality, and so we can either say that actions related to climate action or sustainability, environmental sustainability. We can either call them a seventh dimension of quality, as some have proposed, or if you look around, climate action is a part of most of these circles. Safe, timely care. Imagine if you can't even get to deliver care if there's a climate-related catastrophe. Efficiency and waste. About 30% of healthcare, as you know, is low-value care and waste. We do a lot of that. And all of those things that I showed you in that blue circle, the medications, the products, the procedures, the tests, they're all, if you overdo surgeries, that's all low-value care, and that's a component of quality. And then my colleague Jody and I said, essentially, this is not an aspiration goal anymore. Healthcare systems, this is not aspirational. You have to start integrating sustainability and climate conversations into your governance now. This should not be something aspiration in the future, that this is something feel good for future. No, you have to think about this stuff now. So the individual actions are essentially around sort of three large domains, and this came out even in the morning session. Things that you could do as, like an individual level, the microsystem. Here's what healthcare workforce and patients could do. Then the next level up is what can healthcare organizations do, health systems can do. And then thirdly, what are the policy levers, what are the professional societies, what can they do, what can regulatory bodies, what can accreditation bodies like Joint Commission do as well. Now, things we can do in care delivery, I have a lot of clinicians sort of talk about this, like what are the things we should do. Low value care, I talked about. We as clinicians and healthcare workforce can influence the procurement, ask for better, greener products. We can cut down travel. If you don't need to see the patient to let them know that their test results are normal, and you don't need to come back, and they don't need to come back and see you. And then we can reduce waste. Think about all the single-use plastics that we use in our healthcare system, all the waste that we produce from a lot of the surgeries, a lot of the procedures. There's a lot of plastic. One thing people forget is a lot of the plastics come from fossil fuels. 98 to 99% of the chemicals that are in plastics, all that is derived from fossil fuels. So that's the clear connection between sort of the climate movement and the plastics movement that's going on. And then Choosing Wisely Canada just produced, some of you probably heard of Choosing Wisely campaign, where sort of people talk about interventions that shouldn't be done because they're useless or low value. They produced some recent climate conscious recommendations. That means things that are unnecessary tests, treatments, or procedures that they consider should not be done based on their environmental and climate value, not related to cost or anything else, but strictly, and these are freely available, a lot of the recommendations. They're specialty specific, so no matter what specialty you are from or what system you're in, you'll find something that you can relate to. And this is a report that I wanted to sort of lay out as sort of one of my final points, that there's actually guidance. There are a lot of tools, documents, and frameworks that have been produced of how to build operational, how to operationalize a lot of these recommendations. How do you build systems that are low carbon, sustainable, and resilient? And I would encourage all of you, a lot of you know about the WHO Building Blocks framework. This report builds on that and produces sort of these recommendations as to what health systems can do going forward, including monitoring. I'm going to conclude by saying, I think this is a quality and safety problem. I think I've made the convincing case that you all need to sort of pay attention to this. There's lots of tools and resources, so we don't have to sort of start afresh. Lots of people have already started doing on things, so if you want to do something in your health system or your country, lots of resources to look at, and every healthcare professional, safety, quality, and all healthcare professionals, including patients, should get involved in this. So I want to thank you for giving me this opportunity. We're going to quickly now go into the panel, and hopefully we might still have some time. I know we've been cut short, but hopefully we may have some time for some questions at the end. All right, so I'm going to start with, the first question is to my friend Ezequiel here. And it's about, you may have sort of heard, I think Joint Commission had a panel on sustainability, they may be having it now. Joint Commission has gone into this space, IHI has gone into this space, ISQA has gone into this space. So think about all the quality and safety organizations that we know, they're already into the climate space. So my first question is for Ezequiel. What are these organizations doing? What do they need to do and what can they do better? Take it away.
Well, hello everyone. Thanks for the invitation. Oh, sorry. Thanks for the invitation and thanks Hardeep for the facilitation. You know, whenever we were invited to join this panel, we were given some questions and comments that somehow got rephrased today, and I believe in the right direction. And maybe I wouldn't say what the other ones are doing because I cannot maybe comment that much about JCI or IHI. I have the sense that other organizations are really trying to incorporate in their portfolio climate change as a mission, as a value of the organization, service or product. But in the case of ISQA, the organization I represent today, I thought about 3 words that hopefully we are pursuing and describe what we're pursuing. One is advocacy, the other one is engagement, and the other one is guidance. And for that, I prepare some nice slides that finally we decided not to show, but again—
That's my fault.
But in that slide, I show a report that ISQA just published about green care is high quality of care. And if you just put green care and ISQA, that will come to your screens in your Google search. And the authors are Ossenbord and Adita Bias, plus some more people. Those were the ones that prepared the report for ISQA that's been published early last year. And on advocacy, going back to the comment that I mentioned before, we need to have clear messages. And you know, the message that was crafted by Jeffrey Brownway for the audience is these 3 numbers, 60, 30, 10. 60 might be or maybe not the effective care or the value care that we provide to people. 30% is the waste, and 10% unfortunately the harm. Of course, the rates could change, but it's a clear message about the percentage of the right care, wasteful care, and harmful care. And that is in very good relation to climate change and to pollution, as you have said before, and I want to repeat over that. Then engagement, and I have the sense that ISQA, as other professional societies, are the conveners for healthcare providers, decision makers, and patients and families to get together in discussing ways to change how healthcare is worsening climate change. Because unfortunately, through waste, we are worsening the situation. We're trying to help people, but unfortunately, we are treating people for the outputs of climate change, but also we're getting it worse. So hopefully that help us to change direction. And finally, guidance. And I have the sense that our societies eventually can provide evidence-based recommendations through members, through the people that we work with, in order to hopefully change the tide. But unfortunately, it's not very easy. And again, I cite again the green paper that ISQA recently provided to the community, and that was pushed or maybe impulsed by Jeffrey Brownway, the previous president of ISQA, that is very engaged in this topic. We asked to be short.
Good. Thank you, Ezequiel. And if you want to see his slides, I'm sure he can offer it on the app. We can put it all the slides on the app.
Slides for the next moment.
So the next question is for Cecilia. You know, I get asked a lot from clinicians, like, what do we do as clinicians, and like, how do we get involved? And so my question, Cecilia, is how do we mobilize the healthcare workforce in general, and how do we scale this across? So it's not just one institution or one country. We get the entire healthcare workforce mobilized on climate action.
Thanks so much. Really a pleasure to be here. Really excited to be talking about climate health at a quality and safety meeting. So in my position, I direct something called the Global Consortium on Climate and Health Education. And so we have a mission to ensure that 100% of health professionals globally have the knowledge and skills to prevent, recognize, prepare for, and respond to the health impacts of climate change. There's something like 65 million just nurses out there in the world. But if you think about the role of health professionals being in every single community, one's going the last mile, if health professionals have a knowledge of how climate change is impacting health and how we as citizens and as the healthcare sector can prevent and ameliorate the issue, we can get very far in terms of affecting climate change, and that's just my perspective. In terms of how we scale this, there was a survey that was done in 2020, and now this was a voluntary survey. It was done by a group of medical students who really have been leading this whole charge in terms of education and climate change. They found that only 15% of schools globally, medical schools, 15 were teaching about climate change and health. So 10 years ago, the World Health Organization declared climate change the greatest threat to global health of this century. And yet 15% of schools are even talking about it. So there's a huge discongruence between how we're responding in terms of the education to our students and what the scale of this problem is. There is an incredible role for health professionals in responding to health impacts of climate change. That includes early diagnosis and treatment of climate-sensitive conditions. That's diagnosing dengue and Lyme disease in places where we haven't seen it before, but now it's becoming more prevalent, so emerging infectious diseases. Diagnosing heat stress in pregnant women instead of just saying that they have, they're vomiting because in their first trimester of pregnancy. No, it's heat stress. We have to be more aware of how the climate is impacting the health of our patients. And as we do that, we make better diagnoses, we make them more accurately, we make them quicker, we reduce low-value care, and we improve patient health outcomes. So we have to be on top of this, and we have to understand this as clinicians. The other thing that clinicians do is we decide what care gets determined, as this has been said, in healthcare settings. And we can choose to avoid low-value care. We can also design protocols that avoid low-value care and institutionalize them. I think the role of health professionals, that includes nurses, pharmacists, oral health professionals, and physicians, in terms of leading this within healthcare systems, is huge. So how do we go about this? At the Global Consortium, we have over 400 health professional institutions that have pledged at the level of the dean or head of school to train their students in climate and health. And that's because of a groundswell of this next generation of health professionals who cares deeply about this and sees the impacts already in their communities. So we mobilize the youth who care about this as their future while we engage leadership. I think there's also a huge role here for accreditation bodies in terms of thinking about how do we develop standards, competencies to ensure that our clinicians are actually able to make the right diagnosis and provide accurate care at the right time.
Thanks, Cecilia. And you've written a lot about this, including a paper that I know is in JAMA Open. And I believe a lot of your competencies are on your website. Yeah, so that's great. So this is another great resource for people. So, one thing I've been noticing, I've been in the space now for about 4 years or so, and I have been told by several people who are sort of more on the environmental side and the environmental and health side and the sustainability side and the climate side that people in healthcare, especially clinicians, don't often sort of talk to them and often will give a little bit of pushback. And generally I know from quality and safety, we have a lot of silos. And so my next question is for Reina. We have so many fields working together that we need to break silos in, right? So the environmental health, public health, quality and safety, healthcare professionals, healthcare leaders. How do we break silos across all of these fields?
Thank you for this easy question. The integration of insights from various disciplines significantly enhance the effectiveness of patient safety and climate protection. Interdisciplinary and interprofessional education and training for health professionals provide an excellent foundation for achieving these shared goals. A combination of expertise from public health systems, quality assurance, environmental science, and healthcare management leads to more sustainable, safer, and more effective solutions. Interdisciplinary collaborations make it possible to identify risk at an early stage, develop innovative strategies, and optimally leverage synergies between climate protection and patient safety. In my mind, we need a holistic understanding and risk analysis to sustainably anchor the connections between climate change and patient safety in all of us. It's urgently necessary to further advance both public health and environmental sciences as well as quality and safety management. This will enable us to better research the impact of environmental factors on health, like air pollution and heat waves, and develop preventive measures to protect vulnerable populations. Additional environmental friendly safety standards for medical facilities must be implemented. We must work intensively on the development of sustainable and safe treatment approaches. This will support the research and implementation of climate-friendly technologies like energy-efficient hospitals, sustainable pharmaceutical production, and the promotion of low-emission transport and logistic concepts for medical care. It's essential, of course, to ensure that new sustainable processes also maintain high quality of treatment and high level on patient safety. Another pillar for overcoming silos in healthcare is the promotion of interdisciplinary innovations. We need to push much more the development of digital solutions to monitor climate factors and the impact on patient safety. At the same time, AI should be used more extensively to predict climate-related health risks and enable early intervention. Public health and politics, evidence-based strategies must be implemented to adapt the healthcare system to climate change, as well as the introduction of environmental friendly hospital policies through political governments. So I think break down the silo walls.
Yeah, one thing you mentioned about AI being used extensively, yes, I'm sort of a semi-enthusiast or not so much of an enthusiast for AI. One reason is it has a huge climate footprint by itself, right? It's hugely energy efficient. Yeah, it sucks out all the energy from the energy centers. So we have to be, justify its use. But I agree with you that there's a lot of potential in order to do that. Okay, so now let's move on to patients. I think patients have been an integral part of the quality and safety movement. They've become more active than ever before. Every session we go to, we hear the patient voice now. So I want to hear from the patients. What can patients do for the climate and environmental sustainability? And patients and patient organizations.
I think I kind of like your, phrasing the question, but then I started thinking, are really patients engaged? So I think, can I pose a question right now? So how many of you think that patients are meaningfully engaged in your system?
On anything? on quality and safety or environment?
On anything. On anything generalized, I'm talking about in generalized, are patients being meaningfully engaged? I think at most of the places, yeah, so which country are you from?
Australia. He comes.
Okay, Australia. So at least there's one country that's really meaningfully engaged patients. I'm really glad to see that. But most of the places, what's happening is that, our participation is kind of tokenism, we're just there, sitting on the table, we are not even recognized enough, because everybody is talking about patients and healthcare, so, we just get a seat there. But I think still there's a long way to go. But as Hardeep started off, healthcare is a big polluter. We are a very big polluter, more than, I didn't know that we are more bigger polluter than the aviation industry. So what can we do, Can the health system by itself, improve the situation? I think that's not possible, All the healthcare stakeholders really need to take and play their part in improving the situation. And patients being the largest group of stakeholder, I think really need to play a lot more important role in all of this. So what can we do? We are not the ones who are controlling everything, but there's so much that we still can do. So we can, create awareness about, environmental health. We can advocate for our cause. We can, talk to the government. We can talk to the policymakers that there needs to be, Clean Care Act, those sort of things. Then I think we can talk to them. We can talk to the healthcare providers. We can ask them for, technologies that are, good on, that produce less emission, that are better for the environment. I think that's very important. We can also work towards, educating patients through workshops, conferences. We can develop resources, online resources, training materials. I think until and unless the patients and the communities are not on board, I think we won't be able to achieve much, at least as far as the environment is concerned, because we are all polluting it ourselves. So it's not only the healthcare side of it, I think it's the other part of it as well. When we're living in the society, we are not looking after it very well. So I think patient organizations can also do an important part as far as that's concerned. Then we can change our habits. We can, try to live healthy lifestyles, walking, and cycling, and egg-based diets, all of those things. But most importantly, I think it's important that we, as a healthcare stakeholders, we get together and we decide, that we need to really make a difference as far climate change is concerned, patients can be involved in research, as you said. It's very important. We need to understand, what is the health impact on us, of the environment. If the UV radiations are they causing skin cancers and similarly other things. So I think there's so much that patients organizations and communities can do to help the overall situation as far as the environment is concerned.
Great, thank you so much. One thing that you mentioned about, yes, we're not have patients engaged as well. At least in US, the numbers are quite high of the amount of public that knows that climate change and climate action needs to happen. 60 to 70% of the public, no matter who they are in US, is concerned about climate. And I'm thinking sort of, mobilizing, as you said, patient organizations can do a lot because people are already thinking about it, so they've already taken the first step, and how to get them engaged to do more is sort of the next big step. Okay, so we talked about could the healthcare systems do this alone? And the answer is probably no, and everybody has their shared responsibility to act, right? So Rhiannon, thinking about what can a healthcare system do? What kinds of things your healthcare system, what are the practical things you could do? Have any suggestions on your recommendations?
Right. One example might be in the dimension of healthcare facilities itself. So more sustainable practices such as energy efficient buildings, environmental friendly procurement and waste reduction, as you mentioned before, need to be implemented. Of course, the focus should also be on climate friendly treatment methods, such as the use of environmentally friendly anesthetic gases, or in radiology, especially with CT scanners and MRIs, energy consumption can be significantly reduced by consistently shutting down some of these devices during off-peak times, such as night or weekends. CT scanners are not actively used over 60% of the time and consume a large amount of energy. I think we can change that. Another example highlights the opportunity provided by regulatory authorities and certification bodies. Development and enforcement of guidelines to reduce the carbon footprint in the healthcare sector is a crucial aspect, as the healthcare sector is responsible for nearly 5% of global greenhouse gas emissions. We should make it mandatory to integrate climate-related risk into safety standards for healthcare facilities and train and establish sustainability officers in both outpatient and inpatient sectors. Another essential factor is promoting collaboration between different stakeholders. It's crucial to establish joint platforms to foster interdisciplinary collaboration between science, politics, and industry. A good example is the creation of networks for sharing best practices, such as the German-speaking Network for Patient Safety Research, which is active in Germany, Austria, and Switzerland. The identification of win-win situation is linking environmental friendly actions with efficiency and cost savings, and defining patient well-being and sustainability as shared goals that must be presented more transparently. Use of regulatory and incentive systems contributes to the reduction of environmental impact. Equally important is the provision of subsidies or tax breaks for sustainable innovations. And another step might be the promotion of public-private partnerships. This facilitates the expansion and collaboration between the healthcare sector, business and governments, as well as the financing of research projects. As a rector of a medical school in Germany, improved education, awareness, and scientific research projects are, of course, very close to my heart. We urgently need more interdisciplinary training for health professionals to raise awareness to connections between climate change, health, and patient safety. For example, at our university, we offer students in the health professional field joint elective modules to promote interdisciplinary collaboration through problem-based learning. Extremely helpful is also the initiation and increased promotion of joint scientific research projects, such as the Global Consortium on Climate and Health Education and the European Network on Climate and Health Education. At our university, we founded the Institute for Safety of Patients and Health Professionals, where we work interdisciplinarily and interprofessionally on topics such as planetary health, mental health, and
patient safety. So these are some examples where we can work with.
Yeah, I mean, there's a long list, right? There's so many things that healthcare organizations can do. And you also mentioned sustainability officer. I wonder how many hospital systems have sustainability officers that are working on some of the topics that we're talking about today. You know, in the U.S., there was a Healthcare Human Services pledge, where you pledge towards a net zero emissions and climate actions, you know, over time. And they invited all U.S. hospitals to sign up for the pledge and do certain things and get to some certain goals related to emissions. And out of the 6,000 U.S. hospitals, by the end of the pledge was over when the administration changed, as you can imagine, January of 2024, 25. Only 1,000 hospitals, only 1,000 U.S. hospitals had signed up for that pledge to do anything about climate action. Now, some probably didn't want to sign out and say anything publicly. There's a lot of things to do, but it just shows that we have a long way to go in a lot of the activities that you're talking about. So I think the next question, Cecilia, is for you. I mean, where is success? What does success sort of look like? And where is global leadership in strategies in this area?
Yeah, that's a great question. I would say, and just following up on where health systems are, I mean, I think there's a huge range. Like, there's hospitals that have completely decarbonized and are living in the future. And then there's hospitals that have done absolutely nothing, which is good and bad. It means that we really have great models that we can follow, but to your point, there's many that aren't following the lead. On a global level, you know, I've seen several countries that are making huge strides. And I would say one of the biggest barriers we have in order to create this transition that we need to go through as a society is education. Someone mentioned in the last panel, you know, the health profession has like more, you know, PhDs or MDs than any other profession, right? But we somehow, you know, we actually need more education here. We need education specifically in strategies to decarbonize and adapt our systems to a future climate that we have never seen before, right? And we have to work with climate modelers. We have to work across silos. We have to work with risk managers, quality and safety in order to do so. So we have to scale education on a global level, I think, Hardeep. And it has to happen at so many levels, starting with, you know, where people get training, academic institutions. But then who's going to teach the students? Because faculty don't actually get this education.
Yeah.
So we're working to develop training programs for faculty to train the trainers so they can train the students, right? And then we have to be thinking a level up of thinking about how do we train institutions, how do we train ministries of health to be able to do this work. So we recently worked with the Andean Health Organization as an example, and we trained the Ministries of Health and Environment of the 6 Andean countries in how to do vulnerability and
ratings and all that. So I'm going to start with Hussain here, but I want everybody to comment, should we get patients to assess as a part of patient experience with?
But they actually directly impact our health. And again, you know, many of the wastes and the pollution that comes out of the health industry, that also affects our health. So I think that's very important that these healthcare organizations play their part in improving the healthcare. I've got a study here by Harvard in 2015, and it says that the hospitals with green building certification report better patient outcomes, including lower infection rates and faster recovery times. So I think the proof is already there. That I think that there's improvement. Then we also know that the climate disasters, you know, when they strike, you know, they disrupt the health systems, and many patients, you know, and many communities are unable to seek health care. And it's also, you know, proven the fact that, you know, the healthcare facilities that are more sustainable, that, you know, that are working on environment as well, they have solar panels, you know, installed and all of those things. So they are, you know, they are the ones who continue to provide those services, even, you know, in times of disasters when others cannot. So I think that's very important that the hospital and the healthcare facilities, especially, you know, they look after these things. Then the healthcare providers, I think they also need to step in, and I think we as patients expect them to lead by examples in reducing the environmental harm and aligning with the principle of first do no harm. So I think that's so also very important. So I've done a study from 2024, and that basically found that 68% of the patients are more likely to trust healthcare facilities with strong sustainability commitment. So I think the patient confidence, as you said, is more in those sort of facilities. And as World Patient Alliance, we would advocate for patient-centered sustainability, and we believe that environmental responsibility is not a separate component, but I think it's part of the patient safety and quality component, so it should be looked after as one thing rather than separate things.
Awesome, Hussain. And I want those studies, the ones you found, so
Yeah.
I don't have to look for them now. So that's great, excellent. Other comments from panelists about this issue?
Can I go to your final question?
What's that?
Can I go to my final question?
Oh, well, no, we're just gonna comment on firstly. You can get there in a minute, but anybody wants to comment on this issue of should patient experience measure and rate and healthcare organizations' environmental sustainability and climate?
Yeah, absolutely.
Yes.
I mean, I think that would be just really fascinating, and I think patients are more aware of this than we know, and they're watching everything. I mean, sitting in the waiting rooms, waiting in emergency rooms, they see things that we don't see. And I would imagine that they would also have input in terms of how we could improve our processes. I also think that, as we're talking about mitigating carbon footprints and reducing waste, there's cost benefits to this. And some of those cost benefits should be passed on to patients, to consumers. And what does that look like, right?
No, so before going to the final question, I also like to mention that one of the projects I have been part of recently is a global project called the People Voice Survey, which is a survey has been done in 25 countries, developed from a group called Quest. It's a message center, but different meaning. It's a quality evidence for health systems, and this group developed a survey, a population-based survey that's trying to assess different aspects of healthcare, which are related to competency, patient-centeredness, things that are not only experienced on the quality ratings, are just how well the systems function for patients. And also climate change is part of that in terms that we're not harming them. So it's the People Voice Survey.
Do you have anything to add? I mean, it looks like the case is already there.
No, look, you should look for that instrument because it's
No,
coming
definitely.
somehow.
Maybe the next grant, Cecilia, we should put a grant on this. Yeah,
we
let's
might
do it.
compete for that.
Yeah.
But anyway.
All right, and we're calling on everybody to be collaborators. We'll do this globally.
So regarding my final comment.
Well, let me tell you hang on. So I want to paint this picture. Now, a lot of the patients will say, well, we're not seeing the connection because right now there's so much harm going on just from healthcare itself, people having medical errors. I think the question that Ezequiel, you have to answer is how do we make that connection between sort of, harm on one side and integrate this with the quality, safety movement, kind of bring them together.
I will try to deliver.
Improve the connection between the two.
So again, look, for me, it's clearly a strong connection between patient safety, waste, and as another manifestation, and climate change as another manifestation of human waste. Because somehow we have been wasting resources and we're paying for that. So for me, the connection, I have a challenging question for you now, Hardeep, is that, because
I didn't change the question.
for 3 times. The first time the question was to continue listing what resources we have available or interventions could be useful for this. I have the sense that since I heard my colleagues and things that surely people know in the room, I should like to list more things, but again, I should mention what we have learned from the patient safety movement.
Yeah.
Because harm is a very important issue, and we haven't done enough yet. Because I have the sense that in the last 50 years, technology advanced a lot, and so far, the health systems are failing people because we cannot move their healthcare the way it should be for the moment. So, and with considering harm, it's the same case because harm is there. We continue to measure. We could still find ways to understand how it happens, but unfortunately, it's not coming down. And that might be also the case for climate change because how many other things we need to realize about the climate change and the effects on healthcare on health of people, and also we are part of the problem. And so I don't have the answer, of course, but one thing that we haven't mentioned yet are payment systems. We are paid to contaminate because we are paid to waste. We're being paid to use. And here we're using society resources in different countries to increase expenditure in healthcare, not giving enough value. So I believe that another thing that we should put in place, trying to make the connection between safety, quality, health systems, and climate change, is the way we finance care. In the Western Hemisphere, which is the place I know the most, pay for performance is the most common payment systems in somehow, and that's producing lots of harm because, and how that I came to this in the last 10 minutes, because I just made this comment in my mind while we're here to you. How will that happen in my country, where 90% of the care is provided fee for service? How can I stop providers to stop delivering certain care when they earn money for doing that? So that's the thing that we need to consider for future changes.
Yeah, and on an optimistic note, there's a group of peers, at least in the United States, and they're also working with some across, including Bupa in the UK, that have started to listen in to some of these conversations, and they're working towards strategy to try to bring these two things together.
Yeah, and I think there's some unlikely allies. You know, in the US, who pays for healthcare? Well, it's insurance companies. So insurance companies are quite interested in preventing low-value care, preventing hospitalizations, preventing unnecessary ER visits, right? And so what can insurance companies do as benefits to their clients? Maybe it's help with air conditioning. Maybe it's, thinking about air filters when there's bad air quality, right? So how do we align this with the interests of those who are the payers? I think we've seen the most progress in terms of climate change in areas of the world that have socialized healthcare systems because they see the benefit of reducing air pollution as a preventative strategy in order to prevent exacerbations of respiratory diseases, escalation of cardiovascular disease, poor birth outcomes, etc. So I think it's really aligning interests and getting the right payers involved.
Any other comments from the questions? So I negotiated with Faye that we're going to go up to about 4 or 5, right? Then it's a hard stop. And the panelists have been so good and on time that we still have time for questions. So please take it away. Think of the questions that you want to ask about this topic and before we close for the afternoon. Yep, Jeff? Do we have a mic for Jeff? Do we need a mic?
It was very clever that you took the mic away.
I know, I knew you were going to be asking a question, Jeff. It was going to be a tough one.
Yeah.
I'm going to see which one I want to answer it. I'm thinking Ezequiel.
Okay, so this is a fantastic session. You are all to be congratulated.
Is it better than yours?
No. But it was fantastic. However, you have been very reasonable. I want to make you unreasonable. 2015, we went to COP21, and the world agreed, 196 countries agreed, that we would limit greenhouse gases to 2% and try to get to 1.5. And everyone had to submit plans, every country had to submit plans. They all agreed to do this. And the biggest worry we had, if you cast your mind back to that, the biggest worry we had was low and middle income countries were trying to industrialize, and they were going to use fossil fuels, gas and oil, and coal in their quest to industrialize. The biggest worry we actually had was China. And China was building coal-fired energy sources faster than a speeding bullet. 10 years later, the biggest problem is not China. It's not developing countries trying to industrialize. It's the US, which has turned its back on science, climate change, and equity and inclusion. And it's decimating the world's efforts because it was previously in a leadership position. It's decimating the world's efforts to get where we need to get to. Discuss.
My views do not represent the...
Or because healthcare is enmeshed in this problem, and it's day 74 of Trump, and he's got 1,382 days to go. If he doesn't get a third term, what are you going to do about it?
Okay, you want me to talk, you're going to have all recording devices off, including the ones over there. I have a lot to say, but if anybody else wants to start a question.
My question is, of course, the U.S. has a leadership position and may influence everyone's agenda, but it's only the U.S. or other countries or regions of the world that are having such a stop in moving forward to promote low carbon emissions. It's what's happening, because I have the sense that whenever one government step ahead, there might be others following. It's not all that.
Can I? I think it's a thing of it's a matter of priority. So if climate is a priority or not, I think that's more of the thing. I think we can just forget US for the moment, for the next few years, because yeah, I know, but you just can't reason with somebody who's But the thing is this. I think let's take the example as Hardeep presented. He talked about aviation industry. So there's no government involved there, and they managed to bring down their emission lesser than the health sector. So nobody, it's their commercial thing, or their professionalism, whatever you call them. But they have brought down the emission lesser than the healthcare system. So why can't we do it? Why can't we have the same sort of standards set for our organization? Why are our organization? Why are our pharma company big polluters in the industry? I think that's the matter of priority. That's what I think.
But wasn't that related to cost? I have the sense that the aviation industry increased carbon emissions because they were paying a lot for fuel and they wanted to be more efficient at cost. But sorry, going back to the payments, in terms of the economic incentives are very critical to this happen.
Yeah, but I think as we discussed in the morning that OECD and other organizations they have presented their case that for every dollar that you put in, you save $10. I think what more than we can ask for? I think it's the policymakers. I'm talking about the global healthcare policymakers. We're talking about the country level policymakers. I think they need to sit down and they need to come up, and come to a consensus that this is doable, this is cost effective, as you said.
Yeah, I think this is going to change when the economic incentives start aligning properly around sustainable energy. Economic incentives start aligning properly around procurement of energy from renewable sources. I think that's one. The other thing that came up in your excellent panel was this conversation around what we call scope 3 emissions, which are supply chains, which are not just specific to the healthcare sector, but which represent 80% of the greenhouse gas emissions from the health sector. And just bringing it back to the US, California, which is I think the 7th largest economy in the world, when they set standards, for example, fuel efficiency for cars, all car manufacturers make their cars to those standards so they can sell cars in California. And I think that we can take a similar example to supply chains and say, look, if enough conglomerate, if the EU gets together, or if the Andean region gets together, or Southeast Asia, or OPEC gets together and say, look, we're not going to buy these products unless you actually start focusing on supply chains, you'll start changing these global supply chains, even if it's not the biggest country out in the lead. It's enough of the top 10 getting together and saying, this is what we're going to do, because there's still influence there. And the US is very heterogeneous, and I think what we learned from the last Trump administration is states end up taking on pretty big power, and they can lead, and they can be formidable in some ways. Hopefully.
Yeah, well, I was going to say states, local governments, and I'm going to still insist that the healthcare professional has a huge role to play in disseminating the message around what we can do. For some of the things that I was describing that healthcare itself can do, by the way, I was going to be involved, and I'm sure Cecilia was too, with the Office of Climate Change and Health Equity in the United States, which was decimated before or on January 20th of 2025, when the new administration came in. That office had lots of resources, lots of sort of goalposts, lots that they were trying to do. But I think some of the work can continue, because clinicians and hospitals and healthcare systems and nurses and everybody involved in healthcare can still do the right thing for the environment and disseminate that message to the patients and the general public. As a scientist, the most important thing I'm doing right now is not to communicate about science about sort of the people like you. I want to get to the general public. I want to get to those states, the red states, and tell my message. I'm in Texas, so I'm trying hard to do that. Because I think if the general public understands this better, not only will they vote better, it's important, they will act better and they'll change their behavior. Yeah.
So, hello everyone, I'm Sonali Ved. I'm a technical officer with the Wipro regional office here. I'm going to be one of those annoying audience members who doesn't ask a question. I sort of want to just share what climate change means to me as a citizen of the world. And I live, before moving here, I was in Delhi and I'll be going back there in the beautiful month of June where it's going to be 50 degrees Celsius. Every summer for the last 4 years, I get at least 4 to 5 calls from people, usually from low socioeconomic in Delhi, and it started getting flooding. So imagine ambulances, patient movement, disaster hospitals have started getting flooded in the capital city of Delhi. So, he's in reasonably good shape compared to the average Indian 81-year-old male. So he recovered, didn't have to go to the ICU. But now I'm actually leaving my job to go back to India so that I can relocate my parents to another city, because in Delhi, the pollution levels are so high that the machines cannot read beyond that level. So it goes to 999 AQI, and most winters, right now it's around 250, I would guess, which is hazardous for health, which we don't notice because we are very used to it. And in winter, you can actually feel it. Your eyes start burning. If I travel in an auto rickshaw in India for like 2-3 trips, I get a sore throat. And this is a city of, I don't know, what's the current population, maybe 30 million. And it's not just Delhi, it's the entire northern belt, all the way going into Pakistan, where we have very high pollution levels, so very large populations being affected by this. And currently I'm working in Wipro, so I got to learn about the Pacific Island countries, whose existence is basically threatened by climate change. So I don't know if you're familiar with the COP, and one of the ministers who actually, from the Pacific Islands, who actually stood in the water to give his speech. And countries like, I think Tuvalu has actually created a digital copy of its culture because its existence is threatened. And Tuvalu is basically the size of an airplane landing strip, right? So if sea levels rise higher, then it's going to get worse. So till a few years ago, I wasn't paying attention to climate change because, oh, there are so many problems in global health. I'm interested in safety and quality. You know, patients are miserable, let me just focus on that. But in the last 3 years, my mentality has totally shifted. And I think all of us in healthcare, I think like Hardeep said, we all have a role to play in climate change, whether we are in safety, quality, and even just as citizens of the world. So thank you all very much for this panel and for prioritizing this very, very important area of work.
Thank you, Sonali.
Not annoying at all.
And
just misdirecting public attention and outrage. So that's where, that's where the government is at present.
Yeah. One of the things that we're doing at the Global Consortium is we have a program called the Climate Care Champions Program, where we're working with ASHA workers to train them in preventing, diagnosing, and treating heat-related illness. Because as you mentioned, a lot of people actually don't know what to do. And there's 1 million ASHA workers, and there's just so much potential to again, relay information and education to people who are being impacted immediately, and we need to scale this.
Thank you. I think we're at time, and I was supposed to have a closing sort of a remark, but all I'm going to say is I think the arranged marriage between quality and safety on one side and environment and climate is going to be a successful one. So let's do this. All right, thank you.
Very much, Dr. Hardeep, and to our dear panelists. That was quite an enlightening discussion about the impact of climate change on patient safety and what synergistic partnership could do to improve its outcome. So before we formally end this session, do you have any final words, Dr. Hardeep? All right, let's proceed. Now to give this...
Thank you to my panelists. They were awesome. Everybody say that now.
Let's give them a round of applause. Now to give the certificate of appreciation to our esteemed speakers, may I call on Yusek Gloria J. Balboa, Undersecretary of Health from Integrated Resilience Office. Let me read the citation first. This certification of appreciation is certified. This is to certify that Dr. Hardeep Singh has been recognized for his valuable contribution and participation in the 7th Global Ministerial Summit on Patient Safety, held on April 3 to 4, 2025 at Asian Development Bank, headquarters Mandaluyong, Metro Manila, Philippines, given this 4th day of April 2025 in Mandaluyong, Philippines. Signed by Dr. Teodoro Herbosa, Secretary of Health. The same citation is given to Dr. Ezequiel Garcia Elorrio. Welcome, sir. The same citation is hereby awarded to Dr. Cecilia Sorensen. The same citation is hereby awarded to Dr. Rainer Petzina. The same citation is hereby awarded to Dr. Hussain Jafri. All right, may I request Thank you, everyone. That concludes our panel discussion.